Hi folks, I'm Dr. Don Kennedy. I'm the medical advisor for Nerve Renew, and here's a question we get a lot. What can I do to treat my neuropathy pain naturally? I'm going to tell you about 5 things. Target the causes of inflammation. Number 2, feed your nerves. Number 3, you got to have at least a 3-point attack. Number 4, a simple, repeatable ritual. Number 5, you got to be persistent. So first of all, it's number 1. Target the causes of inflammation. Hey, remember this. Every disease we see, no matter what it is, has an inflammatory process, inflammation. Specifically in neuropathy, inflammation is damage of the myelin sheath, everything that has to do with the nerve. That's the wrapping around the nerve. These products are called AGE, A-G-E. They're called advanced glycation end products. And where do these things come from? What is it that's chewing on these nerves? Well, for instance, fat plus sugar equals AGE, these products. And what they do is they attack the collagen, which is a basic protein in every part of our body. So if you think about what these causes are and why I say target the causes, it's diabetes, it's heart disease, it's a general aging process, but remember, the result of this is also Alzheimer's. When the inflammation starts, it affects every single nerve in your body. What's the biggest cause? Believe it or not, yes, it's all our diet. What we eat and how much we eat. Remember that. Diet, diet, diet. Can you measure these products? Can you measure this inflammation? There's different ways, but nothing specific. I know that A1C and diabetes, the amount of inflammation in your body can be measured by that. Getting an A1C in diabetes down below 7 is an indirect measurement of how much inflammation is going on in your body. So that's it. Number 1, target the causes of inflammation and kind of know that's what's causing all of the problems. Number 2, you got to feed your nerves. People ask about these natural supplements, and I'll tell you what, they are all well studied. We know, especially in regenerative medicine, that you take the supplements that are research-based, they will work to heal your nerves. People say, well, what's supposed to be in these supplements? There are 3 major components to a supplement you look for, which is in Nerve Renew. Number 1, you have to have R-alpha lipoic acid. What is that? Well, it's a special substance, a special natural substance. It's an antioxidant that fights these AGE components that tear your nerves up. They actually go in to prevent the damage, and they stop these AGE products from actually, I call, chewing on your nerves, causing the damage and causing damage to the actual axon, which gives you the ability to communicate from nerve to nerve and get from the periphery, which is your arms and legs, to the brain and back. Number 2, you gotta have vitamin B12, but not any vitamin B12. It has to be methylcobalamin. That's a special type and a special absorption. And what's it do? It actually repairs the myelin sheath where alpha lipoic acid prevents damage. This is a repair mechanism. Again, better communication along the nerves, better communication to every part of your body to increase the ability for you to understand what's going on outside. And I mean like stepping on something hot. The third thing you need to have in feeding your nerves is this, vitamin B1 thiamine, but again, it's not just the typical thiamine you take over the counter. It's benfotiamine, and this is a powerful substance in terms of increasing circulation. As a matter of fact, we use vitamin B1 after heart surgery to increase the ability to keep the arteries open. The result of this is also increasing nerve density, the number of nerves per portion of the tissue. In other words, when you get a lot of damage, even if it's trauma to your nerves, you'll find that the number of nerves able to communicate from that area die. So you need more nerves in each area of the body, the fingers, hands, toes, feet. If you can take like a benfotiamine, a vitamin B1 thiamine, as part of your natural substance, then circulation increases, the number of nerves increase, and conduction improves. The other number 3, I say, is the 3-point activities. You're not just going to get away with taking something orally. You have to do something. You can't sit in a chair all day. So number one, I tell people is look, exercise absolutely reduces inflammation. For instance, you got to work on three areas: balance, flexibility, and believe it or not, some of the best are the oldest: yoga, tai chi. Anything you do rather than sit still will reduce the inflammation. So that's exercise. Number two, diet. This decreases those age formations which cause the inflammation. So I've got this thing I tell people. It's called FFF VEGS. FFFVEGS. And I've said this to patients for so many years. Fish, fruit, fowl, vegetables, eggs, grain, and salad. FFF VEGS. VEGS. That's the first thing. It's what you put in your mouth that matters. Number two, as part of that diet, is listen, calories count. If you're eating so much, the body's going to take that excess and turn it into inflammatory processes. 1,500 to 2,000 calories of great food, as I said, my FFFVEGS, will really help you in terms of weight loss, also control blood sugars. And one that people don't talk a lot about is social. You got 3 points of activity. You can't stay home by yourself. You need help to achieve these goals. I tell people general activity. Yeah, a lot of people use the internet. I like Facebook activities. I like the fact that people can communicate because it motivates people. But also, this is a non-specific activity. Just getting out and going to church or going to an activity, going to a music festival, gives you a better well-being and also motivates you to get up every day and go do something. It just makes you happier. So that's my 3 points: exercise, diet, and social activity. And number 4, and this is like my key, simple ritual of health. You can't do 6 million things, but you can do 3 or 4 every single day. So what do? You create a repeatable ritual that you'll do every day so it becomes automatic. Every day you'll do the same thing. Some people say it get boring, but I'll tell you what, when you can sleep better at night and you can play better golf, or at least get on the golf course, or you can go bowling, then this repeatable, simple ritual becomes the core of what you think and do. Example, I tell people, look, every morning you take supplement like a Nerve Renew and the Optimizer every single morning, first thing when you get up. Number 2, you've got to have some type of exercise. If it's yoga, go do yoga. If it's Tai Chi, go learn that and do it. Find an exercise you can do every day, and don't do it for 6 hours. Do it long enough so you'll continue to do it and it'll be fun. Yeah, you got to sweat a little bit, but think about what that's doing to the blood flow everywhere. The other part of that, in terms of a simple ritual, is you take your supplement, you do your exercise, and you try to eat 3 times a day on a regular schedule. It controls your blood sugar. No, you can't eat a lot at night. That's the biggest cause, and I think, of increased blood sugars, but also weight. People get home, they get bored, they watch TV, and they eat snacks, and that habit's just completely unacceptable. And the last thing I say in terms of this ritual is have a normal social situation where you're talking to people. You're on the phone if you're not out. I like people going out mostly because it helps them walk. Even if you're in a wheelchair, wheeling a wheelchair or standing up periodically matters, because you're talking to people and time goes fast. It doesn't look like or feel like you're doing something that's imposing. So number 5 of this is this: be persistent. Yeah, you've got this great schedule every day, but remember, this schedule has to go for years. You got to be a tortoise. You're not the rabbit. It takes 6 months, every study out there, taking a natural supplement to increase the nerve conduction. Actually, they show that it's 80 to 90% increased in terms of the electrical activity in nerves because of the healing process. It can begin in as early as 3 weeks. Some people have noticed that difference, but 6 months, and then you never stop. Remember, you're treating neuropathy and you're preventing neuropathy, and it's about one simple thing. And I always tell patients, it's where you want to be at this time in your life. It's the quality of your life. So people ask, hey, how do you treat neuropathy naturally? The 5 things. Target the causes of inflammation. Feed your nerves with great supplements that are research-based. Do a 3-point attack and do a simple ritual you can do every single day. And don't watch a lot of TV. That's not a great part of your ritual. And be persistent. When you look at where you're going, look ahead for years and say, this is the thing that I can do every single day, and I know it'll get better. And that's just the fact. So this is Dr. Don Kennedy, the medical advisor for Nerve Renew. I hope this helps.